Good morning, friends. Today we are going to discuss the pathology and clinical significance of diabetes mellitus. Diabetes mellitus is a complex metabolic disease which is characterized by hyperglycemia, and this hyperglycemia is either due to insulin deficiency or tissue resistance to action of insulin. So we have problems in all the three metabolisms: carbohydrate metabolism, protein metabolisms, as well as lipid metabolism. And because of that, there is a very high incidence of complications in diabetes mellitus. It's the most common metabolic disorder which is seen world over. The incidence of diabetes mellitus increases with age. 2% population of USA are suffering from diabetes. And it is now estimated that nearly 5% population of India is suffering from diabetes mellitus. By the year 2015, it is believed that nearly 20 to 25% of the urban population of India will be suffering from diabetes mellitus. So it's an ever increasing disease worldwide, and therefore we have to know about it as much as possible. This is the photo showing the typical counter or appearance of a diabetic patient, the pear-shaped body. Now, how do you diagnose diabetes? The diagnostic criteria for diabetes mellitus are either a random blood sugar about 200 milligrams per deciliter with clinical signs and symptoms. I'll come to that later. What are the clinical signs and symptoms seen in diabetes? Or a fasting blood sugar level which is more than 126 milligrams per deciliter when the sugar estimation is done more than twice. So if for 3 consecutive readings you get fasting blood sugar level more than 126 milligrams per deciliter, then you can call it as diabetes. A single reading or a paired reading is not enough or not sufficient enough to diagnose a patient as a diabetic mellitic patient. An abnormal oral glucose tolerance curve, where patient is given 75 grams of glucose orally and then his blood sugar is done every half an hour. Now in such a condition, if the 2 hours post glucose blood sugar is more than 200 milligrams per deciliter, then it is definitely diagnosis of diabetes. Now what if the sugar is between 140 to 200? About 200 is diabetes, below 140 is normal. If it is between 140 to 200, then such a person is thought to be having an abnormal glucose tolerance test. Okay, we'll talk about abnormal glucose tolerance test later on when we'll be discussing type 2 diabetes mellitus later on. And the fourth criteria, diagnostic criteria, is an HbA1c which is equal to or more than 6.5%. Okay, this is the latest diagnostic criteria published in Diabetes Care 12010. Now, what are the clinical features of diabetes mellitus? The main clinical features are hyperglycemia or increase in blood sugar level, glycosuria or increase or passage of glucose in urine, polyuria, that means excessive urination, polydipsia means excessive thirst and excessive intake of fluids, and polyphagia or excessive intake of food or craving for food, increased incidence of infections, and disturbances of vision like blurred vision, development of cataract, blindness, etc., and paresthesia or neurological sensory deficits like tingling, numbness, or weakness of one of the limbs. The lesser symptoms are lethargy, stupor, weight loss, breath smelling of acetone, fast, labored breathing, what is known as Kusuman's breathing, nausea, vomiting, abdominal pain, and urinary infections. The lesser symptoms are usually seen in cases of type 1 diabetes mellitus, and in type 2 diabetes mellitus is usually polyuria, polydipsia, and glycosuria, which are the main presenting features. Now, classification of diabetes mellitus. You have The classification is necessary because the treatment and the pathogenesis of the various types of diabetes is different. We have primary type 1 diabetes mellitus, primary type 2 diabetes mellitus due to genetic disorders. Under these genetic disorders, we can have defects of the beta cell function and defects of the insulin action or insulin processing. Insulin processing means the action of insulin on the insulin receptors. Now, both these things can be affected due to genetic disorders. The next type of diabetes, or the next causes of diabetes, are usually secondary diabetes, means there is some other disease and diabetes is caused because of that disease. So pancreatic diseases can also give rise to diabetes. In this we have chronic pancreatitis or chronic inflammation of the pancreas, which causes destruction of the exocrine as well as endocrine part of the pancreas and gives rise to decreased insulin production and diabetes. Fibrocystic disease of the pancreas, which is a genetic disorder, congenital disorder. In these patients we have fibrocystic changes in the lungs, in the bile tracts. They also develop diabetes. Pancreatic calculi or stone formation or concrete formation in the pancreatic ducts. Usually alcoholics develop this pancreatic calculi. In addition, there is an area around Hubli and Belgaum where there is a high incidence of pancreatic calculi. One of the pathologists there has been trying to find out the cause, but he has still been not able to pinpoint and find out what is the cause of this pancreatic calculi in that particular area. And last of all, neoplasms or tumors of the pancreas, either benign or malignant, can give rise to diabetes. Other endocrine diseases like Cushing's syndrome. Cushing's syndrome means hyperadrenalism. That also can give rise to diabetes because of increased levels of steroids. Okay. PCD or polycystic ovarian disease can also cause diabetes and diabetic-like changes. Now in this PCOD you have multiple cysts developing in the ovaries, and because of this cysts developing in the ovaries there is no follicle formation, and that gives rise to increase in estrogen, and this hyperestrogenism in turn causes hormonal disturbances and induces diabetes. Infections, especially viral infections due to Coxsackie virus, cytomegalovirus and mumps virus, can induce diabetes because of their direct destructive action on the pancreas. They lodge in the pancreatic cells and they multiply in the pancreatic cells and destroy these pancreatic cells, and that gives rise to diabetes. Drugs can induce diabetes. The best two examples are again steroids. Steroids in small doses given a long period of time, or steroids given as a big bolus, both can induce diabetes. Then diuretic agents like hydrochlorothiazides, they can also induce diabetes. Okay. Why this should be mentioned? Because patients who have diabetes, if they have renal impairment, you should avoid giving them hydrochlorothiazides or diuretic agents which are derived from hydrochlorothiazide or Lasix like derivatives. They should be given some other type of diuretics. Then chromosomal abnormalities like Turner syndrome, Klinefelter syndrome and Brown syndrome, that is Mongolism. In these conditions also you can have developed diabetes mellitus. And last of all, you can have gestational diabetes. Gestational diabetes is diabetes